Hello, nursing students. Today we're going to focus on an important aspect of neurosurgical care, understanding craniotomy positioning. Let's jump right in. A craniotomy involves temporarily removing a part of the skull to access the brain. Proper patient positioning is critical as it influences both surgical access and safety. First, let's talk about the supine position, often used for accessing the frontal and parietal lobes. The patient's head is slightly elevated and tilted away from the side being operated on, which helps in reducing swelling and pressure. Moving on, the lateral position is typically used for surgeries on the temporal and some parietal lobes. Here, the patient lies on their side. It's important to ensure the head is securely fixed and correctly aligned with the body to avoid any undue stress on the neck. The prone position is primarily used for procedures at the back of the skull, like the occipital lobe or posterior fossa surgeries. Elevating the head in this position helps in managing venous pressure and minimizing bleeding. Though less common, the sitting position offers excellent access to the posterior fossa and can aid in reducing bleeding by using gravity to keep the surgical field clear. However, this position has risks like the potential for air embolism, so it's used judiciously. In all these positions, our main goals are ensuring the patient's comfort and maintaining physiological stability. The head must be securely held to prevent any movement, which could be critical during the operation. Continuous monitoring of the patient's vital signs and intracranial pressure is also essential throughout the procedure. That wraps up our quick overview of craniotomy positions. Understanding these will help you support the surgical team effectively. If you have any questions or need clarification on these positions, feel free to reach out or discuss this in your study groups. Thank you for joining and keep up the great work in your studies.